Last talk, I'll try and keep it brief and crisp so the pitta doesn't get aggravated beyond the V and V1, P and P1. Um, so quickly talking before I get into my presentation, one thing I would really love to say that over the last 15 to 20 years, I've been going to health conferences, Ayurveda conferences, technology conferences. What is really heartening to see today, and this is for the first time I'm experiencing this, just like how different ministries are coming together to form one view of Bharat, the physicians, the scientists, the industry, and the academia are converging on what should be the vision for Ayurveda moving forward. And two resounding learnings for me uh, are: one, it is not in hospitals, it is not in clinics, it is at home. And two, it does not move away from the core principle of looking at every individual as a unique individual and personalizing healthcare for their benefit. So those two are the key learnings that I take away from this convergence. And I'm very happy that the 9 speakers before me, whatever they've said, essentially makes my job easy, because the last slide that I will show you is essentially talking what everybody has just said and how it comes together. A quick background, this is important because telemedicine at Jiva started in 1995. This was at a time when private institutions did not have access to internet in the country. And we evolved that methodology in 2004, won the World Summit Award at Geneva, the only UN awarded project in Ayurveda, which was taking Ayurveda to the rural communities. The first Ayurveda app, if you see that phone, it was hard coded onto the phone itself. To today, where we've done almost 4.5 million plus teleconsultations only. These are not physical consultations. It's in addition to this, 4.5 million consultations through the tele route only. Created the largest personalized Ayurveda telemedicine that exists in the world, bringing technology innovations to see how personalized Ayurveda is delivered to the masses. In order to do this, Jiva undertook the first data-driven, big data analytical white paper, which was published in a European journal, essentially to say that whatever is written in the Shastras is not mere traditional practices, it is rooted in proven what Dr. Saab had said before me, that it's a mathematical science. And if it is a mathematical science, it will show trends, it will show correlations, longitudinal studies which big data analytics can capture. Two, we created decision support systems for Ayurvedic doctor, wherein uh, predictive algorithms work to help doctors identify which will be the right medicine combination for this unique case that the patient is presenting, basis the learning that the system has created of the 4.5 million consultations that it has done in the past. And moving on to a health app where the patient is always connected. With that background, I come and I present that what role does telemedicine play? What role does telemedicine play specifically in Ayurveda? Why Ayurveda? Why telemedicine? I will not spend too much time here. Accessible healthcare today, the country has zero point 0.6 doctors per 1,000 people compared to the recommended average of one is per 1,000. 75% of these doctors are in the urban areas. So can you imagine the skew when 68% of the country still lives in the rural areas? The entire healthcare infrastructure is skewed in that direction. So how do you bring accessible healthcare? Another study by McKinsey, essentially, if you study this graph, the darker circles are infectious diseases. And you see the disease burden between 2020 to 2040 is not coming from there. The disease burden is coming from what you call NCDs. So the diabetes, kidney, skin chronic disorders, digestive, metabolic disorders. So essentially the increasing burden of lifestyle disorders. And we've all spoken here that how these are not necessarily treated with an intervention only approach. It requires a whole system view. It requires a holistic view of addressing these problems, requires behavioral change, lifestyle adoption. Without this, we cannot tackle the disease burden that we're going to experience over the next 2 decades. Technology enables us, we all know this, and Ayurveda fundamentally is set up to be a whole system science. It does not only take into, Rajivji had spoken, the whole Ahar, Vihar, Vichar, and then Aushadhi. So Aushadhi is just one component of the entire treatment that's given out. Also, the concept of Ayurveda, where we are not bodies only, physical bodies only. We are Chikitsa Purusha, wherein what we are saying is that this is Sharir, Indriya, Manas, and Atma. And as a body complex, it has to be treated as a body complex, not just merely as physical bodies where interventions are being made. So if we can combine the power of the two together, if two powers can come together to create, and I don't want to call it telemedicine because it reduces it down to a very smaller scope. I would like to call it something of a connected health. And the three key components of that are that it's personalized, it's affordable, and it's for all. It's accessible by all. So what does this connected health or digitalizing Ayurveda entail? What are some of the scenarios that play out? The Vaidya and the principles are being personalized at scale. And what this means is Ayurveda, which should not be reduced down to the ingredient only, where we try and find out the one magic Ramban and try and mass produce it for everybody. We should be able to understand the principle, utilize that principle, and yet be able to personalize at scale. There is an integrative and continuous care management. A doctor's visit is not a transactional visit where I go, he sees me for a couple of minutes and writes a prescription and then I'm out. It's a continuous care. That's what NCDs require. Can Ayurveda provide that along with technology enablers to provide healthcare that's anytime, anywhere? Today, I am a diabetic patient. I want to know that I am out for a wedding. What do I eat? How do I eat? And if I have by chance eaten something, what do I to balance it off? So it's healthcare delivered anytime, anywhere. Ayurveda integrates with modern medicine, and I completely buy that view that these cannot be competing sciences. They have to be complementing, coexisting sciences. Second opinions and co-case management happens. There was a discussion earlier around centers of excellences in Ayurveda, but by the mere definition, centers of excellence are limited and not accessible to all. Telemedicine. Why can't a practicing doctor go to Dr. Saab and say that I am seeing this cardiovascular patient? Do you mind coming over a telemedicine and providing what do I do? What Chikitsa Sutra do I apply with this patient? And thereby we are able to bring the best of both the worlds, not just integrating with the modern medicine, but integrating with the rest of the Ayurveda Chikitsa ecosystem as well. This, I feel, is the biggest uniqueness we have to offer of creating a new Bharatiya, a Bharat-based model of healthcare, which operates on the uniquenesses and strengths of what our knowledge systems have to offer, and not merely mimicking what a framework has been copied and pasted from the past onto the country. Teleconsults and ad delivery delivered to your doorstep, can that be utilized as a power mechanism of bringing Ayurvedic Chikitsa to countries outside the boundaries of Bharat? Uh, we all know that it may take still some time where Ayurveda gets recognized as a practicing science or a legal science in many countries. But can we use telemedicine to go to these patients? Because patients can choose. Many countries allow the patients to choose uh, on their own healthcare system that they want to use. So Ayurveda treatment crosses borders. That's what we can create with combining technology, telemedicine, and Ayurveda. However, I still feel this is not Vision 2047. This is probably Vision 2030. We should be able to do it in the next 5, 7, 10 years. Then what is the Vision 2047? I read this. This is very famous. It's outside our office, Swastasya Swastra Rakshanam. And very interestingly, in the Shastras, they put Swastasya Swastra Rakshanam before curative care. And it is not, I believe, it is not by accident, it is by design. Because Ayurveda, Swastha, the treatment block is at the core. It's definitely at the core. But then there is a larger core of wellness and well-being. And a bigger uniqueness that Ayurveda as a traditional science has that many other traditional practices lack, it differentiates Ayurveda from many other traditional practices, is a systematic body of knowledge of telling people a way of life. Very beautifully, I think Dr. Gurmeet had mentioned that it is not just about recommending what to eat, but what to eat, when to eat, how much to eat, and if you've eaten something you should not have eaten, how do you balance it off? So that entire way of life is what is going to bring the last component of connected health, health for all. Health for all is not achieved in the treatment block. Because is our vision to make everybody sick? Our vision is not that. Our vision is to make an intervention so you don't need the treatment. That's what the role of a Vaidya should be. And in that context, truly we move from, we call ourselves healthcare, but we are not healthcare, we're disease care. We truly move to our नाम, जो नामकरण हमारा healthcare है, we represent healthcare in its true form. How does it come together? I think obviously the health seeker is in the middle. Can we have every individual, just like I know I am an O positive blood group, I have an Aadhaar card, I have an identity. What is my Ayurveda health identity? Can every individual carry the Prakriti as a tag as we carry an Aadhaar card? It's a Swasthya Aadhaar card. Everybody knows what their Prakriti is because that's the foundational block. There are IoTs and variables. The speaker before me, I think there is already evidence to see we are moving in that direction. We will achieve it before 2047 for sure, where there are biomarkers, there are technologies that are constantly monitoring your dosha, dhatu, and the variances in them as you go by. So Ayur-based biomarkers and nadi, dosha, dhatu sensors are available widely with connected applications and Ayurveda APIs. I think that's a uniqueness. I'm going to come to the Ayurveda APIs in a bit. And what that delivers is that today I wake up and I get a daily diet and nutrition recommendation. What should I eat today? I have traveled to Bangalore from Delhi. My desha has changed, and thereby, what can I adapt to this desha? A lot of people. I was talking to somebody yesterday in the one of the top e-commerce companies in the country, and half the people in the room were from North India, and they were saying how miserable they are because the food that they're eating is not adjusting with their body system. Fundamental problem is going to create a metabolic disorder 5 years down the line. Can we connect that? Vikriti balancing interventions and recommendations. So as soon as V becomes V1, can there be an alert like this, because I have 2 minutes left, saying I need to finish within 2 minutes, right? That's how we correct systems and organisms. Automated alerts based on Shat Kriya Kal. So Ayurveda beautifully mentions the 6 stages of disease manifestation. We only act on stage 5. Why? Everything else, every other training that we do tells us to look at early warnings, early alarms, and act and prevent. Why not in health we do it? So Ayurveda provides this entire framework for us to be able to act accordingly. And I don't believe Vaidya goes out of the system. Vaidya may change his role from disease care to health care, and may not happen by 2047. That may be too utopian. But the Vaidya is connected, the family Vaidya is connected and gets automatic alerts and is able to over teleconnect to you and give you recommendations. 2047, can we envision Ayurveda as a service? It's a platform. How UPI is, how ONDC is. Can we envision whoever develops it, a company, a set of companies, the government, but Ayurveda as a service, as a platform that Zomato knows I am a Pitta Prakriti, my Pitta is increasing, and it's able to show me options that I'm able to choose, and Zomato delivers it to me. There could be dark kitchens. There could be dark kitchens, cloud kitchens that are trained to cook as per Ayurveda principles and send to me what I need. So I think the biggest opportunity that we will have to unlock the economic value, the social value, the health value of Ayurveda is if we are able to curate these platforms. If Google can tell me what to show in my ad based on personalization, why can't we do this with our health? So thank you very much. I have 2 seconds left and lunch is served. Thank you very much.